We're back with Dr. Mark Mandell Brown of the Mandell Brown Plastic Surgery Center and the expert in plastic surgery. And you were talking right before the break about getting rid of scarring and the icon. And I ask about certain types of, I had some plastic surgery years ago that there's visible scars. Will it take care of those visible scars?
It really does help. And
it does.
The icon has 4 different attachments.
Okay.
So one attachment is for hair removal, permanent hair removal.
Okay.
In the bikini line or along the facial line or mustache for men and women. It also has a separate head or separate laser that also treats the broken blood vessels around the nose or the cheeks, rosacea, where your cheeks get red.
Right.
It will help that. And then also broken blood vessels on your arms or legs or chest. And then brown spots as we all age.
Like these, you mean?
Right.
Right.
So that born before 64 who's listening out there, I guarantee there's some brown spots, and you've thought, well, how do I get rid of those? I can't cover them with makeup, or it's just annoying.
And you don't want to show your arms. That's where you either have them on your hands or your arms, or maybe on your face, right?
Right.
And you really want to cover up. And in the summertime, it's really hard to do that. Right.
So with this laser, the icon laser, we can get rid of the brown spots. Sometimes it takes a second or third treatment.
Really? Let me see these brown spots right there? How long do you think?
Maybe 2 treatments.
2 treatments. Yeah, because we don't know, and those are caused by what, Doc?
Well, typically it's caused by heredity, sun exposure, and, I hate to say it, but a 3-letter word called age.
Really?
So age, heredity, and sun exposure.
Right, and some people have more of it than not, right?
And some do.
And is it because of genetics?
And it can be genetic, so that would be the heredity. But, I'm outside gardening and playing tennis and jogging, and so you get brown spots on your skin.
Right.
And this is the greatest technology to really get rid of it.
Wow, and the wonderful thing about coming to your office or coming to see you is when you sit down and do a consultation, you really make people feel comfortable about having any procedure. And your staff is just, oh my gosh, I love those girls. They're awesome. They're really wonderful. And you do a program every year with other doctors that are in their residency or their internship or they're coming out. What do you do on that?
Well, we're always teaching. So we hold a seminar, either at our office or at other medical centers.
Right.
And for example, at our office, we have a dedicated seminar room where doctors from around the country can come. They get lectures, and then they also see live surgery. So they can see the surgery as I'm performing.
In the surgery center that you have.
In the surgery center, and then they get to ask questions, and we're mic'd up like we are now, so they can be in the seminar room and ask me questions. Well, how do you do that, or why are you doing this? And it's live, it's instant feedback. And
that's really important for doctors that are actually wanting to become better and better and better at what they do.
Sure.
And may I ask a question? Do you weed certain people out that shouldn't be in the profession as doctors?
Well, we don't per se.
Who does?
But it's, and that's a great question, because
I hope I didn't put you on the spot there.
Anybody with a medical degree can practice medicine.
Okay.
So then the question is who's qualified?
That's right.
And just because you go through training and you pass a board, doesn't mean that you're the best doctor, that you have the most common sense, you have the best surgical skills, or you have the best judgment. And so it's, many of us have thought about having a actual proficiency test that's nationwide. And it would work like this. If you want to say that you're an expert in breast augmentation, you have to have a proficiency test. So you have to be examined, and you have to be questioned, you have to show your results, and then you get a certificate that says, I'm proficient in breast augmentation. If you want to do tummy tucks, because in the training, Some of the training programs are geared more toward hand surgery or burns or pediatrics. And so not everybody gets the same training for cosmetics.
Really? So that would really help the profession, wouldn't it?
Well, it would help the public identify who's qualified. And basically there's 3 different boards for qualifications.
Okay.
There's the American Board of Facial Plastic Surgery, doctors who specialize in the face.
Right.
There's the American Board of Cosmetic Surgery for doctors who specialize only in cosmetic surgery of the face and body. And then there's the American Board of Plastic Surgery.
Right.
And so all these 3 different boards, and some of them claim, well, we're the only legitimate board, and we're the only legitimate board, and the public gets confused. Well, who do I go to?
Right.
Well, it would be like Ford saying, we only make the best truck.
Right.
And Chevrolet says, no, we make the best truck. But then Toyota comes along and says, oh no, our truck is the best. So how do you know as a consumer?
How do you know?
And that's how you pick the surgeon, and we're going to talk about that.
That's really important because, you know, when there's so many doctors that are out there that are doing, not experimentation, but they're doing things that, you know, like they're a dermatologist and they're doing plastic surgery, or they're this person and they're doing whatever, and it's a little bit nerve-wracking to really find the right person to do the best situation for you.
Right, and so typically, like many people, we talk to our friend, and who did Susie go to, or who did Susie's husband go to, and then that's who we pick. But what you really should look for are what I like to say the top 5 characteristics.
Right, and what are they?
Number 1 is you should look at the doctor's before and after work. I think that's very important to see if they do an overdone look or if they do a natural look. If you aren't impressed with their before and after facelift, or before and after rhinoplasty or nose job, or before and after Botox, before and after tummy tuck, they may not be the right one. It doesn't matter what their reputation is. Number 2, I think the doctor himself or herself needs to be the one who discusses options with you in your consultation. So many doctors are busy, and who does all the consultation information? The staff. But who's the one who's operating on you?
The doctor.
The doctor.
You really want to get to know
So you really
him.
want to get to know the doctor. I think the staff is important because the staff is going to be taking care of you. They'll be dealing with you on a day in and day out basis. So I think the before and afters, the doctor, and if they spend time with you, the staff and how they're treated, and then I think you should go to somebody who has their own surgery facility. If you have to go to the hospital where there's more infections and more illnesses these days, I don't think that's as great for somebody undergoing elective cosmetic surgery.
Right, because so many things can happen.
So many things, and there's just so many infections. So when you have your surgery, you don't know if there was a gallbladder operation right before, or an infected appendectomy right before your surgery.
Right.
Whereas at a cosmetic surgery center, they're all healthy patients. The last thing I think you should look for is it should be accredited. So it should be accredited by a group called AAA-HC, AAA-HC. They're based out of Chicago, and they put the high stamp of approval on surgery centers, and you have to meet over 750 criteria to be accredited by them. So,
and is that displayed somewhere, doctor, when you go into their surgery center?
Well, it is displayed on the wall, or on their door, or on their website, but you can always ask, is this an accredited facility? And so that's very important.
Because of?
Because really Joan Rivers made a real statement, the care that she went, because it wasn't a AAA-HC facility.
Right.
And there were a lot of things that went wrong in her care, and the combination of all of them really cost her life.
That's right. And that's really important. You know, your life is the most important thing.
Right.
And that's one of the things that you do for the plastic surgery associates or whatever, is you travel the country inspecting these different surgery centers, right? And you unfortunately have to go how often?
Well, I've been fortunate because I'm on the board of trustees of this organization.
That makes it big difference.
And I've been a surveyor for them for about 10 years. And they set, we were talking about the bar being set for venous and other treatments.
Right.
But they set the bar extremely high. At the hospitals, it's called JACO, or JACHO, and for surgery centers, the highest accrediting body is AAHC. I'll survey about 4 or 5 centers around the country, where I'll spend a day or day and a half checking out their infection protocols, making sure their staff is educated, making sure that they meet all these rigorous criteria.
And that is so important to that patient, the patients, consumers, other doctors, and staff as well.
That's true.
Is that true? Can you give your website again?
I sure can.
Okay, would you? And I know you write articles and blogs, and we're going to have more information as you're coming onto our website as an expert, and we'll have tons and tons of things and blogs on there of yours and different things that are happening in plastic surgery, correct?
Correct.
So if you would give that out again.
So our website is Mandell, M-A-N-D-E-L-L-B-R-O-W-N, MandellBrown.com, and then also theplasticsurgeryexperts.com.
And we'll be right back on Born B464 in just a few moments.